Homotoxicology is a model that shows how the body maintains self-regulation with respect to toxic assault. It's a description of disease as not a problem that just randomly strikes out at people from out of nowhere, but rather as the body's logical and intelligent response to a true underlying problem. Although there is a lot of complexity that we can get into in homotoxicology, I'm going to be using the example of cigarette smoking to show how simple this model can be and how helpful it is at understanding what disease truly is. I want you to imagine that someone just starts smoking today, and their body's initial response will be a cough. Does this mean that they suddenly have a coughing disease, that the cough has just stricken them from out of nowhere? Well, of course not. A cough is the body's attempt to quickly excrete toxins from the lungs. Imagine that the cough was treated as a disease in and of itself. With this limited understanding, the nervous system may be poisoned with drugs, so that the nervous system could not even be told to produce a cough. So now we have someone who is able to smoke and not produce a cough or show any other symptoms whatsoever. Does this mean that the coughing disease is cured? Well, no, of course not. Suppressing the body's ability to cough may, in the short term, give the appearance of improved health, but in the long term simply drives the disease deeper into the body. If you can understand that suppressing a cough from smoking with medications would not cure anything but just drive the disease deeper into the body, then you can basically understand what homotoxicology is about. There's a lot of complexity that you can get into with this model, but on a very basic level, it's quite simple. There is a progression of disease as toxicity moves deeper into the body. The disease or symptoms that people experience is not the problem. It is simply the body's response to the problem of toxicity. As the toxic assault gets worse, there is something called progressive vicariation, where the body is producing stronger reactions in order to deal with the continuing assault. There's a chart on this slide which is showing the progression, but we're now going to go through each of these stages in order so you see exactly what's happening. The first phase is excretion. This is simply a toxin coming into the body and the body responding by trying to violently expunge it. So, coughing from smoking is an example, but also vomiting, diarrhea, increased urination, mucus, phlegm if you have a cold. These are all examples of excretion. The second phase is inflammation. If the body is unable to quickly excrete a toxin, it then produces inflammation to more effectively go after what's stuck in it. Examples are dermatitis, impetigo, tonsillitis, nephritis. Using our smoking example, this would correspond to acute bronchitis. Years ago, medical doctors would frequently remove the tonsils from children if they were getting infected. It should be clear that surgically removing someone's tonsils because they get frequent infections is not removing the infection. It's not improving the immune system. It's not promoting health in any way. It's a violation of the Hippocratic Oath that you first do no harm. All that removing tonsils would do is remove the body's immediate presentation of an infection, but it doesn't mean that the underlying infection is gone. And with this model of homotoxicology, it's clear to see that all this is doing is driving the disease deeper into the body in the same way that stopping someone from coughing when they're smoking would just leave the toxicity in the body to produce other diseases later on in life. The next phase is deposition. At this point, the body has been unable to expel toxins through excretion or inflammation, so it deposits toxins within the intracellular space between cells. Examples of this are gallstones, swollen lymph nodes, eczema, nasal polyps. Anytime someone has diseases of cysts or polyps, we need to think about deposition. I also want to make the point that this is an intelligent response because it is depositing toxins in the extracellular matrix before it will allow toxins to be deposited intracellularly where they can really do harm. A very, very common example of this is gallstones. And many times people get infected gallbladders, they have gallstones, they have to go to the hospital, they have their gallbladder surgically removed, and then they're told that's it, now that they're fine. That this is just some type of accident of nature that just randomly happened. It's no accident of nature. Gallstones are something that develops over time because of sluggishness in detoxification, sluggishness in the liver, sluggishness in the gallbladder. If someone had gallstones and they had their gallbladder removed, then they have to have sluggishness in that system. It's just a question of if they're aware of it or not. If the toxic assault continues past deposition, then we move into impregnation. This is where toxins are deposited inside the cells. There is an intelligence to what the body is doing because first it attempts to sequester toxins extracellularly. It's only when that fails that we get into the impregnation phase because the body does want to protect the cells and it does want to keep toxins outside of cells. In the case of smoking, this will correlate to chronic bronchitis. Many autoimmune diseases are at the impregnation phase. And I know many times people will get an autoimmune disease, whether it's Hashimoto's thyroiditis, whether it's lupus or Graves' disease or rheumatoid arthritis, and they feel like it's something that just came out of nowhere. However, if a careful history is taken, then you will see in their past other diseases or symptoms that would correlate to the earlier phases. Once a disease gets to the impregnation phase, it's a lot harder to treat and it will take more effort than if we're simply in the inflammation or deposition phase. If toxicity continues, we then get to degeneration. Now toxins are no longer simply impregnated in cells and disrupting cellular function, but we're getting cellular destruction. With smoking, this will lead to emphysema, which is actual destruction of the lung tissue, or Alzheimer's disease, actual destruction of brain tissue. So these are much more severe diseases. The final stage is the differentiation, and this is where we're going to see things like neoplastic changes in cells or cancers. So lung cancer would be the final stage of the toxic assault from smoking. Now, when we go back to this chart, I hope that it's clear how each of these stages of disease brought on by smoking is the body's best attempt at that point in time to minimize damage. It doesn't immediately go into emphysema. It first tries to excrete the toxins. Then it goes to bronchitis. That inflammation is more damaging than a cough. It will slowly use more aggressive means of dealing with the toxic assault, but there is an intelligence behind this, and ultimately the disease is loading cigarette smoke into the body. There is no random thing that just happens to happen to the lungs. But likewise, when we have other diseases in the body, often we're told by conventional medicine to think of it as some random thing that just happened to us because of genes or bad luck, when in fact it really is our body's logical and predictable response to toxic assault. In the case of smoking, it's very clear how one disease is progressing into the next because it's a very obvious toxic assault and it's all in the same system. But usually the toxic assault may not be so obvious and the effects are going to be seen in different symptoms. So let's consider the case of someone who, as an infant, has colic. You might see a lot of vomiting or diarrhea as the body is attempting to excrete something. Later on in life, as a toddler, this person might get ear infections or tonsillitis. That's the body causing inflammation again, probably to the same toxic assault. Then, as a teenager, the person might get gallstones, might have their gallbladder removed. Maybe this person ends up going on through life without the tonsils and without the gallbladder, both of those removed to supposedly treat and cure a disease, when in fact the underlying cause was never even addressed in the first place. And then later on in life, this person just suddenly gets asthma from out of nowhere. But looking back at this carefully, it should be clear that asthma does not just come in from out of nowhere. First, the body attempts to deal with a toxic assault through excreting it. Then the body attempted to deal with toxic assault through localized inflammation, such as ear infections or tonsillitis. Then the body attempted to deposit toxins in the extracellular matrix in order to protect the cells from the toxic assault. That failed. In fact, the medical treatments, such as taking the gallbladder out, which I do understand in some cases is necessary, but nonetheless, taking the gallbladder out just removes one route that the body has to deal with toxins and will drive the disease deeper into the body. And finally, asthma develops as all these routes of elimination failed. Going through life in the conventional model, this is someone who gets diagnosed with multiple diseases, has to be treated by multiple specialists, might get multiple different medications at different points in life for all these different things, when in reality, it might simply be food allergies to dairy or wheat or candida, something like that. But when not treated properly in a natural, holistic way, and when given aggressive therapies that drive the disease deeper into the body, that's where we could have something like asthma developed, when much more simple therapies early on in life could have prevented everything. So, as a child, this is someone who could be treated very easily, especially as an infant. Infant doesn't have a good tummy. Stop giving it garbage food like dairy and wheat. As an adult with asthma, because these stages have progressed a lot further, it would take more work. You know, as a naturopathic doctor, I would have to go through their entire diet and clean that up, but then also go through that history, and I would know, well, they had their gallbladder removed. They must have a sluggish gallbladder. They need help with detoxification there. Their tonsils have been removed, so there's weakness in the immune system now. There might be subclinical infections and so forth. So the further someone goes down this path, the more stuff there is to clean up and the more difficult the case is. However, they can be helped a lot through natural health. It's just kind of basically understanding that the further along the path someone is, the more work they are going to have to do. Okay, that's it for now. Bye.